recording. So continuing with special tests for the shoulder, the first one we're going to look at is for disruption of the AC joint. So palpation wise, one should be able to feel one's way along to the distal end of the clavicle and then onto the flat shelf of the acromion process, and there's an articulation between the two with a little fibrocartilaginous disc in there and what should be about a 3 mm gap. So if this has been disrupted, there'll be localized pain there. And the test that we're going to perform is a scarf test. So what we ask our client to do is imagine they're putting a scarf across the opposite shoulder and reaching to the superior aspect, sort of upper trapped on the other side. That will cause extreme pain if there's AC joint disruption. Joe, if you want to just bring your arm back down again and back into a relaxed position. So what's happening here is that there's a pivotal axis from the proximal end of the clavicle with the sternum here. The scapula, in moving the arm across into horizontal adduction, is coming around the thoracic wall like so, and you can imagine it's just pivoting on and through this AC joint. So as soon as that movement begins and this travels around, it impinges on this area, and if it's damaged it will become uncomfortable. Quite commonly, if you ask somebody to perform this test and the AC joint has been damaged, they'll rarely be able to reach the point across to the opposite shoulder. So that's a good tester for how they're progressing as well. There is another form of checking, so Jade, if you can just put your arm back down to the side, which is a compression test, and what one is doing is basically linking the fingers like so and just squeezing the clavicle and the spine of the scapula together, and again where that articulation occurs you're obviously moving that joint there, and again that will be causing some pain or discomfort. Personally, I find I rarely need to complete this test because the scarf test is normally quite conclusive on its own, and this is obviously a little bit more aggressive. But if we just show you, that's the position, and we're just squeezing like so, and I would do that very carefully if I suspected that there was damage there. Okay, if we now move on to Sulcus Sign, this is basically where we apply an inferior pressure to see whether there's any gapping or potential subluxation in the joint. So if I just take the arm like so into this position with the elbow flexed, from here I can stabilise the upper arm, stabilise the shoulder, and just pull down in this fashion. And in fact you can see with Jade that there is an indication of a gapping there, because what we're looking for is a change in shape in the shoulder. You comfortable with this? Okay. So as I pull down, this should stay a nice rounded shape, but what in fact is happening is you can see there is a sort of shelf appearing, which is obviously where the head of the humerus is travelling inferiorly, and the shoulder is in fact slightly subluxing. So that is called the sulcus sign, and one can do that with the client seated, or alternatively you can lie them supine on the couch and perform the test in that fashion. If we now check for impingement of the shoulder, we've looked at the painful arc already. There are two forms of tests for checking for impingement syndrome. Again, we're looking for problems below the acromion process where the gap may have narrowed and there's now some irritation of the tissues, normally a bursa problem there. And the first one is what we call the active impingement test, where we ask our client to take their hand across to the opposite arm and just reach for that position. And what that does is protracts the shoulder forward like that, which in itself will narrow that gap and put pressure on the subacromial space. The second test is what we call the the impingement relief test, and as Jade has just demonstrated, they put their hand under the seat that they're sitting on, and then we ask them to lean to the side in the opposite direction, We can see here that sulcus sign a little bit more clearly now, but what it's doing is it's increasing the gap on the subacromial space. So if that alleviates the symptoms, then that's a positive sign. We'll come back to neutral position. So with an impingement relief test, it's a little bit unusual in that with most special tests that we perform, we're looking for an increase in pain. In this instance, a positive sign will be that the pain is actually decreasing as that pressure is alleviated on that area. One more test that we can do from this position is what we call Speed's test, and this is looking for a biceps tendonitis problem, and the particular area that we are targeting is the long head of the biceps. So we need to be able to palpate this, so we would feel around the head of the humerus to start with. I would normally get my client's arm into a nice relaxed position, flexed at the elbow, and from here, if I just palpate around the anterior aspect and internally and externally rotate, I can feel, I've just located it there, that bicipital groove, and it's just flicking underneath my thumb like so. So I can now pinpoint and just put pressure over the long head of biceps. From there, I'm going to take the arm out a little bit into extension, and now I'm just going to passively pronate and supinate the forearm, and that will move the tendon in that groove at the same time as I'm palpating it, and that will give me an indication if there's any pain there that there's a tendonitis problem. You can go a stage further than that and get your client to actively pronate and supinate for you, and if that increases more pain, then again you've got a further sign of a problem. Okay, just relax. Coming back to active passive strength, significantly one particular area that we would always want to assess would be the rotator cuff muscles. So we've shown some special tests for supraspinatus. If we wanted to do resisted movements for internal and external rotation with our client seated, we would take the arm passively, and with the elbow flexed, what I can now do is get resisted internal rotation. So from here, Jade, what I'd like you to do is try and move your arm in that direction. Gentle contraction to start with, just build up slowly, and if it hurts, please do stop. Okay, and stop there. Okay, and then we can change that around and push outwards for external rotation. Good, and relax. So internal rotation, subscapularis is doing most of the work to try and internally rotate there. External rotation, you've got infraspinatus and teres minor on the back of the scapula. This is obviously a comfortable position from which to test those muscle groups. We'll go further than that in a moment and mimic more of a sporting action position where the client would be more with the arm up in this position, and obviously from here there will be much more to do with a throwing action, but we'll do that with the client lying supine. Okay. I was going to go straight on then, but I've got to change the camera angles.
Yeah.